Greetings, Anonymous Party members, and greetings also to those of you considering joining the movement. Thank you for watching. If this is your first video, I encourage you to watch one of the introduction videos to the Anonymous Party available on the website, anonymousparty.org. My name is Nick Borden, and this video is part of a series of videos explaining my ideas, solutions, and positions on the issues in my campaign for the office of President of the United States of America. I am not a Republican, I am not a Democrat, and I am not a Libertarian. I believe that all three of these parties are fundamentally flawed in one common key area, and fundamentally flawed independently of each other in differing areas otherwise. But basically because of their common flaw, which is probably all three of their biggest flaw, I created an entirely new type of party with the intention of changing the way that politics works in our country to restore the entire process to what our founding fathers had actually originally intended. No other party is actually giving the American people true choice when it comes to their leaders. And it won't happen until someone gets into the government and actually makes that change possible. It has to be legislated back to a way where change is a choice is a possibility. Right now, it's all a game of money, and that is how the Anonymous Party is different. I accept no campaign contributions, and nor will any candidate under the Anonymous Party. We will never accept them, and if the party itself ever must accept donations for any reason, these reasons will only be to cover basic operating costs of the website or any other extremely just central non-campaign related expenses just for the website, which would include possibly hosting the campaign videos and such, but just to the point where they're showing people's viewpoints, and this is in general for anybody in the party, not just any particular candidate. But even then, businesses would not be allowed to donate, and individual people would only be allowed to donate small amounts of money each. As soon as the needed amount of money would be raised, donations would then no longer be accepted. That said, let's move along into the topic of today's video. This is a second video in my 5-part series on healthcare reform. Last time I explained tort reform, and today I will be discussing insurance. As most people are aware by now, health insurance is required by law to be purchased by everyone in the United States under the Affordable Care and Patient Protection Act, also known as Obamacare. Ironically, though, the act does not make healthcare more affordable. It makes it less affordable, and it does not protect patients. It subjects them to more scrutiny and more risk than it did before, without the act. I really don't need to go any farther than that with the problems with Obamacare. The media, news talk, radio hosts, TV pundits, and anyone else who wants something to complain about has already pointed out the vast majority of the problems with Obamacare. If you're not already convinced that it's an absolute train wreck, well, then I'm not really sure that anything that I'm going to say is going to make any sense to you. At least not on this subject. I will, however, go over one thing that Obamacare actually would make worse if it even worked the way that it was intended to. If everyone had insurance, the cost of healthcare would go up. If no one had insurance, the cost of healthcare would go down. This is an overall figure, not a per person or per family thing, and certainly not a per year, every year thing. This is an average overall. Without insurance, if you get a medical bill, it would still be expensive, but if you calculate the cost of your premiums, your deductible, and your copay after the insurance kicks in, average it over the course of the year, or at least several years to be safe, you would likely be paying considerably less for the total medical expenses than you would for all those other things combined, especially if you don't get insurance through an employer. Why? Because the insurance company has to make money. Nobody's going to just pay your medical bills out of the kindness of their heart and just ask you to, chip in a little bit to help out. That's not how it works. They are a business and they are designed to make money. So they have to charge more overall than what they're taking in. That way there's something left over to call profit. So they set their premiums at a level so that on average they are taking in more money in premiums than they are paying out in medical payments. So that means by having insurance, healthcare overall automatically costs more than it did before. You will likely have years where it actually saves you money. I know I have. But on average, you'll spend more than you get back from it. Additionally, though, let's look at some of the other effects that everyone having insurance will have on the system. But let me ask you a question. Would it be safe to say that you are more likely to go to the hospital if you have insurance than if you do not? Of course. Most people are at least a little concerned with their money, unless they're ridiculously rich and don't have to worry about it. But if you're not, you will therefore not go to the hospital if you can avoid it. If you can save yourself that money, you're going to, right? But if you already have insurance that you've already paid for or are already paying for, it kind of feels like a waste of money if you don't go to the doctor when you kind of need it or might need it. Anytime that you even think you might need it, it feels like it's going to waste if you're not using it. I like to call this the all-you-can-eat syndrome. Nobody goes to an all-you-can-eat buffet and then eats a plate of salad and leaves. You eat the most expensive thing that they have that you like to eat, and you eat as much of it as you want. Why? Because you already paid for it, and now you're trying to get your money's worth. It's not worth your money to pay $12 for an all-you-can-eat buffet and then eat 8 ounces of lettuce. The same goes for insurance. When you add up all your premiums, you can cover the cost of a minor surgery just about every year, especially if you count the portion that your employer pays on your behalf if you have insurance through an employer that provides it. You won't just go out looking for reasons to have surgery, but you will use the doctor anytime that you may think that you even have the slightest need for it. This actually puts a higher demand on doctors, which, as demand goes up, for any of you who are familiar with economics, as demand goes up, so does price. Unless, of course, the supply is also going up, which in this case the supply would be doctors. However, the supply of doctors has been in a slow decline over the past couple decades. I'm not exactly sure how long, but at least the last 10 years. So with people using the doctor's office more and more, trying to, quote, get their money's worth out of their insurance, the insurance company then has to increase premiums the next year so that they can still make a profit. And it's kind of this dog chasing its own tail thing. The customers are trying to get their money's worth, and the insurance is trying to make a profit, so they're just chasing each other around in a circle. Normally, the rise in premiums would result in a gradual loss of customers. The problem, though, is that many insurance plans are paid for by tax dollars, and therefore the customers aren't really spending their own money, and therefore are not as careful with it. The customers, in this case, would be things like Medicare and Medicaid would fall into this category. Technically, these aren't actually insurance plans, but they function almost exactly the same. When services are needed, medical services, they are billed not to the patient, but to Medicare or Medicaid plans. And then Medicare or Medicaid will negotiate discounts, much like an insurance company, except for, in this case, negotiating discounts means they just tell the doctors exactly what they'll be getting for the services, and then the doctors will sometimes not even perform the services and say, I'm not doing it for that cheap, which is a totally different problem altogether. But then, assuming that the service is provided, they will pay whatever portion that they were supposed to cover to the doctor, and the rest would be billed to the patients, if anything. With many patients, there are still premiums due, especially in Medicare, but they aren't based on age or lifestyle or risk or any other thing that a sane insurance company would actually be wise to consider. But instead, they're based on income. This is especially foolish, since the wealthier a person is, the less need they have for insurance. What is insurance for exactly? It's for preventing a medical bill or medical bills from completely ruining your savings, your finances. If you have millions of dollars saved up in an account somewhere, you don't need insurance. You can already pay the medical bills. So, by billing based on income, you're skewing the entire thing to favor those who can't afford it anyways, so you're naturally not going to be collecting enough money to pay for everything. That's just the way it is. That's why Medicare and it's one of the reasons why Medicare and Medicaid are bleeding money like nobody's business. So what's my solution? Well, I can't very well outlaw insurance now, can I? It kind of goes against everything I stand for as far as freedom of choice. That's one of my main principles is choice. So what needs to happen here again, just like in many other things that I've discussed, would be a drastic deregulation of insurance. I know that sounds bad because a lot of people are kind of conditioned to think that the insurance companies are the bad guy, and while certainly there are some that are behaving a little unethically or a lot of unethically, it's not always the insurance company, and the insurance industry in general doesn't really deserve to be vilified, at least not as a whole, the way that it kind of has been. Obamacare kind of does the exact opposite, though. It over-regulates. And I do have to say that I'm not opposed to some regulation. I mean, there absolutely needs to be at least some. Insurance providers have to be required to pay what they have promised to pay for. They have to conduct business in a way that is not misleading or outright dishonest, but they should also be free to offer a variety of plans to fit a variety of desires and needs and customer types. Obamacare does not allow that. It mandates that everyone has to have insurance that has to meet a certain standard, and the standard is actually very high, and it really isn't necessary for everyone to have insurance that meets that standard. People should be responsible enough to plan ahead. I know that may be asking too much for some. Everyone knows at least a handful of people who just don't plan ahead very well, but part of the reason for that is that they're not really forced to. It's one of those lessons that you have to learn one way or another. But for the life of me, I can't figure out why people seem to think that they need insurance to cover normal, every year, the standard annual doctor visits. It's an expense, the term annual should kind of be a dead giveaway here, but this is an expense that you know is coming. Therefore, you should plan your budget accordingly. You should have the money for this annual doctor's visit. You should also probably plan in your budget for the possibility of a minor issue doctor visit, something like a flu bug or a pulled muscle or something else that doesn't absolutely necessitate going to the emergency room, but still, maybe something that you would get a last-minute appointment for with your regular doctor. But either way, it wouldn't be a regularly scheduled thing. But you should expect, or at least plan for, at least one such type issue per year. Factor it into your budget. After that, I'd still kind of plan on, having at least a little extra set aside just in case something larger happened. Personally, my ideal insurance plan would not cover these normal doctor visits or the cheap little things, but would only really cover true major medical expenses, rather than having a $5,000 deductible like I do have on my current plan, which covers pretty much everything. I'd rather have a plan that the hospital wouldn't even have to deal with the insurance company, and I think most hospitals and doctors would probably love that scenario. But I would submit the claims myself, sending in their bills, and the doctor's office would have to do very little, for me at least, to help me out with the medical claims process. But I would submit the claims myself rather than the doctor, and rather than having a $5,000 annual deductible, I'd have a $1,000 per issue deductible with 100% coverage afterwards. If something like this sounds familiar, this is how auto insurance typically works. If you have a collision, it's $1,000, depending on your particular insurance. Common is $1,000. That's what my insurance for my car actually is. But you would owe $1,000 towards that accident, and then everything beyond that would be paid for by the insurance. So if the bill for whatever it is totaled $2,500, they would take care of $1,500 worth, and I would take care of $1,000. If I had another broken bone, or maybe my wife or one of my children had one, and it was a little different, or different hospital, more severe, and we were billed $8,000, well, again, I would pay $1,000. The insurance would somehow or another take care of the rest. It wouldn't matter how many times I went to the ER, my bill would always be $1,000, and insurance would always cover the rest. Premiums on such a plan would actually likely be considerably lower, since they would only be dealing with the larger expense issues and not all the little things. Most years, personally, I don't have anything over $1,000 unless my wife has a baby. In fact, I think we've really only had 2 visits to the hospital that have costed more than $1,000 that did not involve bringing home a baby. So how do you fix the insurance issue? Like I said, deregulate. Allow the insurance companies to offer a wider variety of plans, not by mandating that they all cover everything like Obamacare did. That's counterproductive. When variety and competition are allowed, choice reigns supreme. Choice makes people act smarter. Lack of choice dumbs everything down, makes it to where nothing useful ever happens. That's the same problem we're facing in government. When the people get choice and competitive pricing, costs will go down. But again, this is not one of the major cost inflators. The best I can figure, if insurance was allowed to be competitive and full of options, it might bring the price of healthcare down overall by around 10%, which would definitely help, but it's not the massive savings that we're all hoping for. I'll admit I really didn't do a whole lot of math in this. I didn't come up with a complicated formula. It's basically just a semi-educated guess. But when you hear my other solutions, you'll see why I didn't rank it nearly as high on the list of fixes. My third and fourth are considerably more important. But the next issue that I'm dealing with is the medical billing practices. This is a little more important. I still think it's the second most important of the 4. But I hope to have this video actually released a little sooner. The one that you're watching now kind of took a little longer than I would have liked. Hopefully by mid-April I should have the next one out. It'll most likely be a little shorter as well. But thank you for watching. And if you've been on the website and the forums discussing things, I appreciate the input and the comments and the encouragements and pretty much anything that's been posted on there but spam. But if you haven't already, please come to the website and sign up for the forums. The address is anonymousparty.org. We also have a Facebook page, www.facebook.com/theanonymousparty, all one word. Or you can just subscribe to the YouTube channel titled Anonymous Party. Feel free, again, to post questions, comments, suggestions, or even tactful criticisms in the forums. I love hearing from people. I've probably talked to 20 or 30 different people from just about all around the United States, but I do still need some help getting my name on the ballots in every state, and preferably actually on the ballot, but at least as valid write-in candidate. I'd also love to have at least a few more people running for offices, hopefully even this November, preferably senators and governors at this point, but anything would be nice to have a few more people run for. But stay vigilant, stay motivated, and stay informed, and then make your voices heard. Your voices are all important because you are the people.